the major priority this year should not have been around school consolidation, but really about our healthcare crisis, because our healthcare system is collapsing. We've got the highest premiums in the country. It is causing an insane amount of pressure, not only on our state budget, but on our businesses, our nonprofits, our families. I think 20% of our income now, on average, is being spent on healthcare, which is crazy. We have an opportunity to really move towards universal healthcare and to be the state that illustrates that this is possible. We can start that by building a universal healthcare program the Vermont way, and to really focus on bringing small town doctors back to our communities, to build clinics that can have primary care practitioners, mental health supporters, admin, and to get people used to being able to go to see a doctor for free and allow doctors to be able to actually care for patients without having to deal with all of the admin, insurance, paperwork, and intermediaries. What we would do is have the state just pay primary care physicians an annual salary that's good, like better than the average. And rather than it being like a fee-for-service structure, where the incentive is to see as many patients as you can a day, the incentive is for community health outcomes. If we were to pass the fair share proposal, we'd have more than enough money to cover that. Plus, like clinic, rehabilitation, fees, basic equipment, and even cover basic pharmaceuticals for things like diabetes, hypertension, asthma. And in the end, that would actually end up saving the state a ton of money. It's estimated like $300 million it would save. Instead of people having to go to the ER or waiting until they're super sick to go see a doctor, they're going to be able to get the best primary and preventative care because their healthcare providers are going to be embedded in their community. This is a really important, I think, feasible way that we can lay the foundations towards a universal healthcare policy. And it's incredibly popular in Vermont. During town meeting in Addison County, like 84% of people were very in support of a universal primary preventative healthcare policy. So if government is meant to be responsive to the will of the people, this is something that we should be advancing and implementing yesterday.